Hi everybody, today I wanted to walk through a little bit of the psychology of an injury and some of the things I commonly see in the clinic and discuss with my patients because I think it can be a really helpful perspective in just thinking about your own injury, or if you're a current patient of mine, this might be a little review of what we've gone over in the clinic, and that might be helpful in and of itself. So a lot of the times we tend to discount the psychology of an injury, especially as athletes. We prize ourselves on really going for it and pushing ourselves, and being able to kind of get our mind around anything and pushing through our injury and making sure we're putting in the work. A little bit of pain and suffering is okay. You're trying to get better and get back to climbing or biking or running, walking, whatever it might be. But a lot of the times in the back of your mind, especially if you've had a more long type of injury, like a chronic sort of injury or something that's on and off, your brain can kind of be playing some tricks on you that can affect your recovery. And it can be really helpful to understand what's going on in your brain, especially with these more chronic injuries, and how that can influence how you feel on a daily basis and influence how your training and your rehab program can go. So in your brain, you have something called the homunculus, which is essentially a section of the brain. It's right about here in the middle. You got the left and the right side, and this is where the internal map of your body hides in your brain. So when you move as a baby and as a child and as you age, this portion of your brain gets more and more developed by your movement. Your arm, for example, your foot, for example, sends information to your brain saying, hey, look, I moved 10 degrees. I put 12 pounds of muscle or pressure in this muscle. We went this far. And the brain categorizes all of this. When you're a baby, you're really uncoordinated. As you get more and more experience in moving, as you age, that mental map of what's going on when you move gets more and more detailed. Now, it's really interesting. The research shows that with an injury, that map starts to become smudged, or your brain doesn't have as good an idea of what's going on when you move that injured body part, because it's not getting all the typical sensory information from that injured area as it typically would. So for example, you sprain an ankle, you might not think a lot about it, you limp on it for maybe a week, or you're on crutches for a week, you're limping on it for a couple weeks after that, kind of babying it for a few more weeks, and then you start to push it a little bit more, you start doing some harder exercises. But before you're actually running again or doing any sort of harder training on that foot, you've had maybe a month and a half go by. Well, that's a big chunk of time when your brain hasn't got the normal pattern of sensory input coming from your foot and ankle into the brain saying, hey, look, I'm here, I'm operating in the normal way. And so what can happen is your brain sort of gets out of touch with what's going on in your foot. And it's really interesting. They've done some studies on individuals with more chronic injuries have a greater time or greater difficulty distinguishing between the left and the right, especially with that injured side, indicating maybe the brain doesn't really know what's going on quite as well. Their proprioception and kinesthesia, which is basically your body's ability to know where the body is without seeing it. So you close your eyes and move your elbow, and knowing where that joint is in place or where it is while it's moving, that's kinesthesia and proprioception. Those can become a little distorted with chronic injuries. So when you're coming to rehab an injury in this sort of situation, it's really important to rebuild your brain's map of what's going on that foot. I think being very intentional when you're doing your exercises, even the easy ones immediately after your injury, can be really helpful in trying to maintain as much brain injured area connection as possible. And then while you're rehabbing, as soon as you can start to tolerate it, doing higher intensity isometrics where you're using that injured area forcefully, but in a fairly pain-free way, to really get those muscle fibers, those nerve fibers stimulated, sending signals to the brain saying, hey, look, we're here, we're doing this, we can do this. And that can help prevent your brain from getting as confused as to what's going on in that injured body part, as well as help your brain trust that injured area. The other thing that can happen with really long-term injuries is that the sensitivity level of the nerves to that area can actually physically change. So normally if it takes, let's say, 2 pounds of pressure to stimulate that nerve to fire, the way the mechanics of that nerve change is it would maybe take 1.5 pounds or even just a pound to stimulate that nerve fiber to tell your brain, hey, look, we got stimulated. And then if you've been in pain for a long time, there's a good chance that your brain interprets that information as pain, even though it's something that normally wouldn't be painful. So keep that in the back of your mind. If you've had a real chronic injury, a lot of the times the pain you're feeling is definitely real. It's definitely something you're feeling and experiencing, but that intensity of pain doesn't necessarily correlate to severity of damaged tissue. And that's just something to keep in the back of your mind. Definitely want to be assessed by a healthcare professional and make sure you're not injuring your body. But a lot of the times with chronic injuries, things feel worse pain-wise than they structurally are, barring more severe sorts of injuries. So when it comes to your rehab, I think really being intentional in those first few days after your injury, try to keep it moving as much as you can tolerate is super important. Keep that area engaged and communicating with your brain in as normal a way as possible. As soon as you can feel comfortable, expose that area to some higher intensities of movement or some range of motion, some stretching, some isometrics to get that area talking to your brain so it doesn't forget that it's there, that it's not forgetting what it's doing. And then if you've had your injury for a really long time, sit down with someone that understands pain science, that understands chronic injuries, and assess out what sort of contributions are coming from your body to make you experience the pain that you're having. Is some of it the nerve hypersensitivity? Is some of it your brain just not being comfortable moving? Is there's still structural damage? Is there weakness? Is there some fascial restrictions or scar tissue? All these things combine together to influence what you feel and perceive as pain, and assessing that out is really, really critical. So anyways, I hope this was helpful in you understanding what's going on in your own body. If you have any questions, feel free to shoot me an email. You can reach out to me at creeksidephysicaltherapy.com, or if you're watching this on resilientrp.com as well. Either of those websites, you can shoot me an email through there, and I can help you better understand what's going on, and I'd love to help you get back to moving at your best. Thanks for watching, and have a great day.